Did you know that anxiety affects 1 in 6 children between the ages of 2 and 8? That's more than 17% of kids who are silently struggling with overwhelming worry, fear, and stress. You might think that anxiety is something that only adults deal with, but the truth is, many young children experience it too. What's even more shocking is that, often, parents don't recognize the signs until it's too late. Anxiety can show up in ways that are easy to miss. It might look like stomachaches, sleepless nights, or even acting out in school. But behind these behaviors, there's a deeper issue at play. Understanding the signs early can make a huge difference in how your child copes with anxiety as they grow. In this video, we're going to dive into the hidden signs of anxiety in young children. From physical symptoms to emotional meltdowns, we'll walk through the key warning signs you should look out for. Plus, we'll share simple strategies to help your child face their fears and thrive. Stick around to learn how you can support your child and make a real difference in their emotional health. Chapter 1. The Silent Struggles. What anxiety looks like in little ones. Anxiety in children often flies under the radar because its signs are subtle. Many parents assume that a child's refusal to go to school or sudden mood swings are part of growing up. But these may actually be signs of something deeper. Studies show that 1 in 6 children between the ages of 2 and 8 experience anxiety, National Institute of Mental Health. Anxiety can show itself in various forms, including changes in behavior, sleep disturbances, or excessive worry. The first step in recognizing anxiety is to tune into your child's emotional state. Look for patterns in their behavior. For instance, do they seem unusually clingy or withdrawn in unfamiliar settings? This might be anxiety speaking, not just shyness. It's important to observe their responses in new situations or when dealing with change. Are they more sensitive than usual? A child who is anxious may become upset easily over small frustrations or changes in routine. Another sign is their physical behavior. Children often don't have the vocabulary to express how they feel. Instead, they may act out or exhibit unusual physical symptoms, like headaches or stomachaches. In fact, 60% of children with anxiety will complain of physical symptoms like these before they ever mention feeling anxious, American Academy of Pediatrics. Finally, consider how they react when it's time to separate from you. Kids who are experiencing anxiety might show intense distress when it's time to leave you, whether for daycare, school, or a family gathering. They might cry excessively, even when they usually handle separations well. Chapter 2. When the tears aren't just tears. Understanding the emotional overload. Crying is one of the most common signs parents associate with emotional distress. But for anxious children, crying is often more than just a moment of frustration. Dr. John M. Growell, a psychologist and expert in mental health, explains that anxiety manifests in the body first, meaning a child may not always be able to articulate their emotions, so crying is their outlet. If your child cries excessively or seems to have frequent emotional outbursts, it could be due to an overwhelming sense of worry. Children with anxiety may not only cry over things that seem trivial but may have intense reactions to everyday situations. For example, your child might cry over going to a friend's house, even if they've done so before without issues. This could be due to their heightened fear of the unknown or fear of something bad happening. Another key to recognizing emotional overload is identifying how a child's emotions shift rapidly. 1 minute they might be fine, and the next, they are in tears. These sudden mood changes are often linked to anxious thoughts taking over their emotional responses. According to the Anxiety and Depression Association of America, ADAA, children who suffer from anxiety may also show behaviors like being overly cautious or constantly asking for reassurance. The tricky part of identifying anxiety through crying is distinguishing it from typical tantrums. Research shows that tantrums and anxiety-driven crying are often mixed. However, children with anxiety typically have a pattern of worry before the emotional breakdown, while tantrums are usually triggered by frustration or not getting their way. Watching for these patterns can help you identify whether your child's emotional outbursts are signs of anxiety. Chapter 3. The worrying patterns, repeated concerns and fearful thoughts. Do you hear your child talking about things they fear constantly? Maybe it's fear of monsters, the dark, or fear of being separated from you. It might seem like typical childhood worries, but when those fears become repetitive and disproportionate, they can indicate anxiety. According to a study from the Journal of Abnormal Child Psychology, children with anxiety tend to focus on their worries, replaying them over and over in their minds. Anxiety in young children often manifests as constant questions and concerns about safety. If your child frequently asks, "What if something bad happens?" or "What if I don't make it home safe?" these are not just random thoughts. These worries are a sign that their mind is struggling to find peace. Studies have shown that children who exhibit obsessive, repetitive thoughts are more likely to suffer from generalized anxiety disorder, GAD, later in life. Parents may also notice that their child avoids certain activities or places because of fear. Whether it's avoiding school, social events, or even fun outings, this avoidance is a protective mechanism. Anxiety convinces children that the world around them is a dangerous place. A child who avoids new experiences or friends might be battling these fears in their mind. It's not just the obvious worries that parents should look out for. Children with anxiety may show signs of perfectionism, constantly fearing failure and becoming upset if things aren't just right. For example, if a child struggles with completing a task because they're too scared of making a mistake, this can be linked to anxiety. The fear of being wrong can overwhelm them to the point where they can't function normally. And then, there's the constant need for reassurance. It may seem like your child is seeking comfort, but it might go beyond that. Children with anxiety often repeatedly ask for validation that they are safe or that they've done things right. This is their way of managing uncertainty, but it can turn into an exhausting cycle. Research has found that this excessive need for reassurance is one of the key signs of anxiety in young children. Child development perspectives. If this sounds like your child, don't ignore these worrying patterns. Instead, help them by offering comfort and calmly addressing their fears. The more you help your child understand and manage their worries, the easier it will be for them to feel secure in different situations. Don't forget to subscribe and hit the bell icon to stay updated on more helpful parenting tips. Chapter 4. Physical Clues. How anxiety shows up in the body. Anxiety isn't just about emotional distress. For many children, it shows up in physical symptoms. When kids are feeling anxious, they might complain of headaches, stomachaches, or feel tired all the time. These are often red flags that something deeper is going on. According to the American Academy of Pediatrics, 60% of children with anxiety report physical symptoms before mentioning they feel anxious. This shows how anxiety affects both the mind and the body. As a parent, it's important to take these complaints seriously, even if they seem vague. Often, children can't fully explain their feelings, so they might express their anxiety through physical discomfort. Stomachaches are especially common among anxious children, with one study finding that 25% of children with anxiety disorders experience recurring stomach problems. If your child frequently asks to stay home because of a sore tummy or headache, it might be more than just a physical ailment. Another clue is changes in sleep patterns. Children with anxiety may have trouble falling asleep or may wake up in the middle of the night feeling restless. According to the National Sleep Foundation, up to 50% of children with anxiety struggle with sleep issues. Their racing thoughts or fear of nightmares can keep them awake long after the lights go out. If your child is experiencing these kinds of sleep disturbances, it's worth looking deeper into their emotional well-being. Physical tension is another common sign of anxiety. If your child often complains about feeling tight or stiff in their muscles, or if you notice them fidgeting, this could be a result of anxiety. Muscle tension and restlessness are the body's way of reacting to stress. Research shows that children with anxiety are more likely to engage in nervous habits, such as nail biting or leg shaking, as a coping mechanism. When it comes to anxiety, parents often focus on emotional symptoms. But it's equally important to notice when your child is struggling physically. Addressing these physical signs can help reduce anxiety before it spirals further. Chapter 5. The social withdrawal, how anxiety affects play and friendships. One of the toughest signs of anxiety in children is social withdrawal. Anxious children may isolate themselves from peers, avoiding playdates, school activities, or group settings. This is often mistaken for introversion or just a preference for being alone. However, for children with anxiety, social withdrawal can be a defense mechanism to avoid the stress of social interactions. In fact, studies have shown that social anxiety affects 25% of children and can lead to problems with peer relationships if not addressed early. If your child is suddenly avoiding play with others, it could be because they feel overwhelmed or fearful of social judgment. Anxious children often worry about being criticized or rejected by others, making social situations feel intimidating. They might refuse to attend birthday parties or school events because the idea of being around other kids feels too stressful. This is not because they don't want to have fun, but because their anxiety is making it difficult to enjoy social settings. Another sign is excessive worry about their appearance or behavior in front of others. Does your child obsess over how they look or constantly ask if they've done something wrong socially? This is a typical trait of social anxiety. According to the Anxiety and Depression Association of America, children with social anxiety often fear embarrassment or humiliation in front of their peers, which can cause them to withdraw completely. Parents can help by gently encouraging social interactions in a safe, supportive environment. Start small with one-on-one playdates or group activities where your child feels comfortable. Gradually increase the exposure to larger social settings, always offering reassurance along the way. Research from the Child Anxiety Network suggests that helping children practice social skills and giving them a safe space to talk about their fears can build their confidence and reduce social anxiety over time. Chapter 6. From Worry to Wellness. Steps to support your anxious child. Recognizing anxiety in your child is the first step, but supporting them through it is where real change happens. So, what can you do to help your anxious child feel better? The first thing to do is listen. Sometimes, simply acknowledging your child's fears can provide relief. In her book The Anxiety Cure for Kids, Dr. Elizabeth DuPont, a clinical psychologist, writes, "The most important thing a parent can do is listen without judgment. This helps the child feel understood and less alone in their anxiety." Creating a predictable routine can also offer comfort. Children with anxiety thrive in environments where they know what to expect. A consistent routine for things like bedtime, meals, and school preparation can reduce the unpredictability that triggers anxiety. Research shows that children with anxiety benefit from structure, as it helps them feel in control of their environment. Mindfulness practices can also be extremely effective for children dealing with anxiety. Simple breathing exercises or guided relaxation techniques can help calm their nervous system. In fact, a study published in the Journal of Child Psychology and Psychiatry found that children who practiced mindfulness techniques showed significant reductions in anxiety symptoms. You can teach your child to take deep breaths when they start feeling anxious, or you can practice these exercises together to make them feel more at ease. Another helpful strategy is teaching coping skills. These skills can include positive self-talk, distraction techniques, or learning to label and express their feelings. For instance, a child might say, "I feel scared right now, but I know I can handle it," to combat anxious thoughts. This empowers them to manage their anxiety in a healthy way. When anxiety becomes more overwhelming, it might be time to seek professional help. Cognitive behavioral therapy, CBT, has proven to be an effective treatment for children with anxiety. CBT helps children challenge and reframe negative thoughts that contribute to their anxiety. Studies show that up to 80% of children who undergo CBT for anxiety show improvement in symptoms, American Psychological Association. Finally, don't forget the power of self-care for parents. Supporting an anxious child can be emotionally draining. It's important for parents to take care of themselves, too. Practicing self-care helps you stay calm and focused, which in turn makes you a better support system for your child. By recognizing anxiety early and implementing these strategies, you can help your child move from worry to wellness. It's a journey that requires patience, understanding, and compassion. But with the right tools, your child can learn to manage their anxiety and thrive emotionally. Remember to subscribe and hit the bell icon for more parenting tips.